That's a tough act to follow. Man, oh man. So I've been at Prenuvo for about 2 years now, and before I get into the things that I do at the company, I do want to share my personal scan, which is not nearly as dramatic, but I do want to kind of dovetail on what you said of what is it like to get a scan. I'm a radiologist. I've been doing it for a long time. You can tell by the gray hair, and I have never been into an imaging center that's as nice as the Prenuvo centers. And so, sure, it's just a look, but it's a start. So 2 weeks ago, I walked up into our clinic in LA, and I was like, man, this place is really nice. And there's a coffee machine, and there's snacks, and there's bubbly water. And they take me to my private room with my setup scrubs. And the woman just says, when you're ready, just let us know, and we'll take you back to the magnet. And it feels like a spa. And so I'm a radiologist. I'm like, what? This does not feel like what I'm used to. And so they walk back to the magnet, and the technologist is obviously super professional, and they get me onto the table, and he says, what do you want to watch on Netflix during the scan? I was like, well, I hear about this Formula One Drive to Survive. He's like, yeah, we got that. So he puts the cage on the head and the body, the coils, and on the one on the head is a mirror, and right behind you is a TV almost that big. And it's obviously flipped, so when you're lying down on the table, you're just watching Netflix. And after a few breath holds and some instructions and an episode and a half of Drive to Survive, he's like, all right, you're done. And so if there is any hesitance on getting an MRI for whatever reason, I just like to say, Drive to Survive is a good one to watch, just putting it out there. For sure, we want to get into what the next thing we can do with whole body MRI is. But in the short term, individuals want to know, do they have cancer? Do they have an aneurysm? And I kind of want to keep that as a bit of a theme. On the precision medicine front, by now, 2025, we have so much data. We're swimming in data. And so how does Prenuvo help with this? And the answer is structured data, and we've heard that as well. We have more whole body MRIs than anyone on planet Earth. We have over 100,000 patients where we've scanned, and every scan is about 2,700 pictures. And anyone in the audience that knows anything about imaging is for 3D acquisition of MRIs, every one of those pieces of information is called a voxel. And so for every human, myself included, we have so much data that we can now do something about it. So for our internal AI teams, with which I work very frequently, and for external AI teams, they see this giant resource of data as a very lovely tool to build things for. I've read scans from many hospitals and many imaging centers across the country, and the quality of imaging that we have at Prenuvo is crazy. We have dedicated centers that are owned by Prenuvo. We've tweaked the magnets over the last 15 years to make them how we want them, and the product that our MRI technologists can deliver to the radiologist is amazing. And it's very cool to see reproducible images every time. I have to remind myself that not everyone's a radiologist. And when you see a tube that a patient goes into, it's hard to know if that's a CT or an MRI. And I have to remind myself that sometimes people get those confused. And so a CT has X-rays, that's ionizing radiation that can possibly cause cancer. And Prenuvo uses MRI, which is not that. So MRIs make images with magnets and radio frequency pulses, not ionizing radiation. And then we're able to get such great images, there's no need to give IV contrast at this stage. And then if we see something on a report or on a scan, then we'll, of course, recommend things, and that might include contrast for the next scan, not provided by us. To kind of, again, dovetail from our prior woman that talked about her experience, in the short term, people have a question. They have, what's happening inside my body? I have symptoms, I don't have symptoms, I'm worried, I'm not worried. I just want to know what's in there, and we can do that. That's what we're set up for. We've got 17 clinics all over the place, and we've got lines out the door to get in there and tell people, do they have cancer or do they have an aneurysm? And that goes out in the report, and everybody's happy. If we want to look, 2 years down the line, 5 years down the line, 10 years down the line, what does that look like? And so this is the middle column on the slide. How do I compare with age and gender matched patients? And so when I got my scan done like a couple weeks ago, I get to see how my visceral fat compared, my subcutaneous fat, how it compared, my organ size, how does that compare? And at this time, the dumb humans don't really know what to do with that data, although we can make inferences, and we've got experiments in the process to work. But this is the first time we have this type of granularity at scale for this type of data. And then one of the things I didn't mention is, since we've been around for so long, we have a whole big chunk that have come to see us twice and 3 times and 4 and 5, and a smaller chunk at 6 and 7 and 8, but still a chunk. And if we can digitize individual biomarkers, now we can have a trend of how you're doing. So specifically, one that's really helpful, particularly for the primary care folks, is liver fat fraction, or hepatic steatosis. I have read, I don't know how many ultrasounds in my day where I just would say, mild, moderate. I mean, I don't know how to put a number on the ultrasound. It looks a little bit brighter than the neighbor. But we can give a number. We can say it's 4% or 8% or 12%. And I very vividly remember reading a second scan maybe 6 or so months ago where someone's fat fraction went from like 14% down to 4%, and that's normal. And so I looked back in their medical record, and they made significant lifestyle changes: cut out sugar, cut out alcohol, increase their activity. And before my eyes, N of 1, I got to see that lifestyle modification did change for this particular patient. And these are the types of things that we want to double down on moving forward. I always say that our scans go from the head to the ankles, mostly because most people are too tall for the ankles and feet to be included. But you can imagine that there's a lot of real estate that's covered between the head and the ankles. And so when we do our reports as radiologists, we have a very checklist type approach where we go head, sinuses, neck, chest, abdomen, pelvis, extremities, spine. And that way there, we can have a nice product that's very reproducible for our patients. Almost the entire part that I talked about has an axial slice, which is kind of like stacks of a coin like this, and that stops at the end of the pelvis. And then we have many slices that go front to back, like the loaf of a bread, and then a few slices that go side to side. The reason why I'm saying all of this is, if you get a diagnostic MRI, they're going to have all those slices for your shoulder or for your knee. And so we're not that specific, but we're pretty close for the things that we care about, the organs in your abdomen and pelvis. I am as big a fan of the United States Preventive Services Task Force as anyone, and we have people alive because of the breast, colorectal, cervical, and lung cancer screening, but that's not the end-all be-all. And if someone has a question, we want to be the place that they go if they have a question. And so we're happy to be the place for patients with questions that want to go beyond the USPSTF guidelines. I alluded to this a bit before with hepatic steatosis, and there are some other things in there too, undiagnosed abdominal pain, where particularly for endometriosis and fibroids, we might be able to direct a woman's care based on our scan. This is kind of like the theme of the show, proactive to reactive, so I'm going to kind of skip that one and move on to the meat here. 61-year-old female showing her visceral fat and her brain volume. And so we're going to split this up into purple and green. Purple, more fat; green, less fat. And I presume there are not that many radiologists here, but on the purple brain, you can see the ventricle is much bigger, which means that this woman's brain is significantly smaller than the counterpart. And so the fact that we have imaging from the head to the ankles, we can do these kind of comparisons. We can look and see where are some correlations that we can look at. Now, of course, correlation, not causation, we get that, but you got to start somewhere. So we published this to show what our AI team is working on right now. I don't know how many scans that I've looked at in my life, hundreds of thousands, something like that. And it's really hard for radiologists to, where do you draw the boundary from mild, moderate, severe? Like, that's a thing. Like, radiologists kind of aren't good at that, certainly not between each other. And so this is something we want to do at scale is what is normal aging, and then what is abnormal aging, and how can we help our other colleagues with the data that we're collecting. So I'm going to wrap up with this slide here, and I'm going to go in reverse order of how I started. Is for our patients that are asymptomatic and we don't see anything worrisome, we can track biomarkers to give them lifestyle advice. And in the middle column, if we want to know how we compare to a population so we can decide how we want to make lifestyle choices, we can do that. And in the first column, it comes down to the person. This is a chance for someone who is worried to get a scan and let us tell what we see. So if there's anyone out there that wants to work with us, we can't do this all alone. If you want to work with us, this is how to get a hold of Dan. He's our Chief Medical Officer. He'd be happy to chat with you and see what we can do together. So thank you very much.
Thank you. Quick question before you go. So if you're going to look at Prenuvo 2035, that's our theme, what's next? Are scans going to get faster, and what kind of insights do you think you're going to get? A lot of sometimes the criticism, there's incidentalomas, right? You have to then biopsy. You're not getting those insights ahead of time and learning from the crowdsourced knowledge of your database?
Two things, geographic expansion. Like right now there's demand in every single state and we're going as fast as we can. So we're trying to get as many people in as want to, number one. Number two, we have a sequence that's fancy for radiologists that looks at the hardness of tissue called DWI. And what we want to use that for is a super fast scan and then do dedicated look at that part of the body. It's a bit technical, but that is where we're looking is like, how do we have like a 2-minute scan, a 3-minute scan, and then dedicate resources to find other things.
Great. Keep up the great work. Thanks so much. Thanks.